Well, good afternoon, everyone. We have with us today Brad Lincks, who is the CEO of Sun Behavioral here in Northern Kentucky. Brad, thanks for talking with me today.
I'm excited to be able to join you. Thanks for the offer, Kris. Um, like Kris mentioned, my name is Brad Lincks. I'm the CEO here of Sun Behavioral Health, located in Erlanger. We serve Northern Kentucky. We also serve a good part of Kentucky and the Cincinnati metropolitan area, up to Dayton and Kettering and a lot of areas wherever we can be of need. We are a joint venture with St. Elizabeth Healthcare, which has been, in the Northern Kentucky area for decades and decades and provide a very good service. So we were excited to partner with them. We've been here for about 2.5 years and really maturing as an organization. I'm excited about some of the offerings recently we've been able to offer. We kicked off in March, actually right as COVID was kind of hitting. We began our substance use rehab program, and that's a 14-day program that we had not had up until this point, where we can get folks that are in need in the community more engaged in rehab. We are finding now with COVID, a lot of folks are isolating and leads to addiction issues, and so and loneliness and depression, and so we want to be here for the community, Kris. So we're making sure we're trying to connect folks through a lot of different mediums. I mean, we have our virtual platform that we have in place that's been really successful. And we have our website where you can go on and set an appointment virtually and someone will connect with you. So we're just trying to find out where we can be. I mean, there's a lot of unknowns with this pandemic. It's not going away, but we're not going away. So we have to keep active with what the needs in the community are.
So, Brad, let's go back to the beginning a little bit as well, because you've given us a good kind of recap. Behavioral health. For those who don't know what is the definition of behavioral health?
Behavioral health really is really looking at just our whole mentality about what we're doing day to day. We all are one step away from needing behavioral health care, and that's care for the soul, mind, and body. I mean, it's we all go through crisis in our lives. We lose loved ones. Sometimes we lose children. Sometimes we have folks in our lives that are suffering from addiction and we feel lost. We don't know where to go. And all those different things can cause us to need to seek out care. And we have loneliness in our lives. We have a time like COVID where a pandemic hits and we just don't know where to turn. And so behavioral health is meant to really encompass the whole mind and body, and be there for folks, and because it can affect not only the mental, the emotional, the physical, all that is affected.
So, and Brad, when you look at this, your typical client population ranges from young to old, correct?
Yes.
How many people can you potentially serve in your new facility there in Erlanger?
Sure. We take care of populations from children as young as 4 through senior adulthood, and we can serve, we have 197 beds here, so we're still growing into this building, and that doesn't happen overnight, but we've been as high as about 137 recently, and with COVID and the pandemic, that's another side of this. There's been some folks who haven't been able to work because of illnesses, and haven't been able to come back for long periods of time, not only here, but elsewhere in the community. So we actually have opportunities for employment, Kris. I mean, while some folks are downsizing or employees that are having to go on unemployment because they're not getting hours, we are really looking for dedicated registered nurses in the community, mental health workers who have the same passion that we share here. So we're a full service, freestanding psychiatric hospital, with the caveat that we have the backing of St. Elizabeth Healthcare. So should a patient have a medical condition that's overriding the mental health issue, we can quickly have that patient go out, get the medical care that they need, then they can come back to us. So
that's a great point.
With St. Elizabeth, which is wonderful.
So you've got both those sides of it. You spoke to the issue of, you're a newer organization in Northern Kentucky, and as you've been growing into the building, you've also been growing into filling out the service needs of the community. And now you've got this pandemic where I think you covered it fairly quickly, but I want to go back to that, is that, this issue of keeping everybody safe from the pandemic and from COVID that isolation has been, you've had to manage that. Kind of speak to that a bit in terms of the eyes of a patient today, with how that might have differed prior to COVID.
Sure. Well, one thing we did very quickly, Kris, we did some commercial pieces locally is one thing that we felt like we needed to do because of the isolation piece. A lot of us have been impacted by the isolation. I mean, I know, and you do as well, dozens and dozens of folks that have had to quarantine for a couple weeks. And I'll just put it out there and be transparent. I had to for 2 weeks. And so I had to stay in my bedroom by myself for 2 weeks. And it kind of starts to feel lonely, and you kind of feel like, so we felt like we need to get out in front of that. So, late March, we did a commercial piece that streamed to let folks know about how they could reach us via our website. Like I mentioned before, you can reach us via our website. There's no pressure. You can set an appointment. All you have to do is show up, and just like you and I are discussing today, you see a therapist on the other side, and we will line you up with the service that you need, whether that's a service at Sun or somewhere else. I mean, we wanted it, and it's been very successful. Had a lot of great feedback from that. We've been able to connect a lot of folks, not only to inpatient services, but to our partial hospital program. And we're also running those from a virtual standpoint. So, we do partial hospital intensive outpatient programs where, folks may be here for 3 to 6 hours. And so on the other side is a therapist running a group. And so again, that's a way to reach folks that may say, I'm not ready to come into the building, but I'll interact with you this way, Kris. It feels more comfortable. And if I need more from that, we can determine where the patient's at and what their needs are.
So fill us in a bit too, in terms of this great facility you now have out there. How does that differ from, let's say I've got a loved one who we feel will need some assistance. So we might normally have just called 911, or we may have gone to the emergency room. How does that differ with how we would potentially utilize your service? What's the difference? Where's the decision point? How does that work?
Sure. Well, we have a full 24/7 intake department here. Intake is our emergency room, and it's staffed by master's level clinicians 24/7. We also are very unique here that we have a registered nurse 24/7 in our intake department. You don't see that in most sites. So we're able to take care of those to really ascertain what's needed as far as the medical need. Now, with that said, if somebody has overdosed, a recent overdose, and someone's involved in trying to get them, they need to call 911. I mean, those patients need to go, they need to be cleared, and then they can come to us. But if there's not an overriding medical issue, then we would prefer for patients to feel comfortable coming directly to us through our intake department. We're screening everybody very carefully when they come through, Kris. I mean, everyone is screened that comes in the building, whether it be, the ambulance services, they have to get screened. Police officers have to be screened. We have to be screened every day. And so we're doing everything to also protect the community when they come in to visit us. And so some of those efforts have been really successful too.
And you're working closely with the local police departments, of course, the sheriff's office, and we've alluded to the strong partnership and the backing of St. Elizabeth. Let's speak then to the bigger picture of just mental health. There's always a stigma to addiction. There's been a stigma to those with any mental health issue. Speak to that for a second, Brian, as to if somebody's thinking themselves, I've got a challenge, can they just walk into the door during those 24-hour periods? Can they call ahead and speak to someone? And how long does that typically take if somebody's right there at the moment saying, hey, I need help and I feel like I don't know where to go? Is Sun the place to go here in Northern Kentucky?
It is the place to go. And again, but we want to reach patients wherever they are to be reached. And so that's why, if they're closer to a St. Elizabeth ER and they feel more comfortable going directly there, we just want people to get help. We want the community to get help and know that help's there. Again, we are a partnership with St. Elizabeth, so that if they're, at Fort Thomas or Florence, they can go there and then they'll be in touch with us. And then we take patients routinely 24 hours, 7 days a week from St. Elizabeth or other ERs that are in the community. So that's one mechanism that can come directly to us. And we are here. And, I feel like those of us that work in mental health care, we're non-judgmental. We're passionate about what we do. And you've got to be passionate to care for folks. And you put a pandemic on top of it, and it can be a scary time right now. So,
Sure.
So we can connect in that way. Like I mentioned, the virtual platform is another way that some folks feel more comfortable to connect. As a beginning, they can call and we can share those numbers. Or like I said, again, they can just walk into the building. And usually, I mean, within an hour or so, for sure, we can see the patient and determine what we would recommend for care. And the recommendations for care could go from, continue to follow up with your outpatient therapist to a wider range of outpatient services that we have here at Sun, or it could be, admission to a program here. And we feel good about the services that we offer. We have master's level clinicians that do therapy groups every day here. And, you're rounded on by a board certified psychiatrist every day. And those are psychiatrists. A lot of them have worked in the community for many, many years and have a lot of really good experience, and can also help connect patients as well.
And just with any other medical condition, people shouldn't be ashamed or afraid of coming in and getting help from you all, obviously. And I guess if there was one thing that you wish that the community would know about, maybe a misnomer or something you think, hey, people just don't understand about the typical client that Sun Behavioral serves, what would it be as a takeaway?
I think my take on that, Kris, would be they're individuals just like you and I. And like I said, stressors in life, we don't know how we're going to react to those if they come up. And these are folks that are hurting, that have maybe taken that step, unfortunately, to use, and it's turned into an addiction, to self-harm in different ways. And they've used that as coping mechanisms. Maybe some of us have more of a family resource than some folks have that we've been able to treat here. Maybe they're folks that don't know how to reach out to their families. And so what I would say is they're people just like us. They just need help. They just simply need our help, and we need to connect them. And I like to really feel like, we've got that non-judgmental approach to say, look, we're going to meet you where you're at. And if you want help, we're here to provide it for you.
Well, that's a great way to end there, and appreciate the work that you and your team do. And of course, the strong partnership between you all and St. E. So thanks, and best of luck as we get through the rest of this pandemic.
Great. Thanks a lot, Kris. Always appreciate the time, and let me know if I can help out in any way.